Each year in the United States, about 13,000 new cases of cervical cancer are diagnosed, and about 4,000 women die of it per year. Now, Dr. Alozie joins us live to discuss cervical cancer. So first, tell us about, these staggering numbers of cases.
Yeah, so I think the first thing to understand is that 13,000 a year, and anybody can really get it, right? Obviously, HPV, which we'll talk about in a minute, is the main risk factor, but there's no clear thing that is driving it more than anything other. HPV is essential, and the important part about it, and we'll also talk about screening, is if you get screened on time and regularly, and you find it early enough, the survival rate and success rate are immensely high.
Well, I'll tell you what, on the topic of HPV, let's go back to that, the human papillomavirus.
Yeah, it's a handful, right? HPV, HSV, there's all these things out there. But I think HPV is this virus that exists, and up to 80% of people that are sexually active can get it. So it's not anything to be ashamed about. If you get it, you get it. Again, the key is screening. Here in El Paso at Texas Tech, and I'm intimately familiar with this because I know some of the authors, they found out that we actually have a higher prevalence of HPV on the borderland, specifically in Hispanic women, and a higher prevalence than average for high-risk HPV, typically what's called 16 and 18.
Wow, okay. Well, what are the two main ways of screening for cervical cancer?
Yeah, so two main ways are something that's been around for like 80 years, right? So it's called the pap smear, where they'll go in, they'll do what's called an endocervical swab, they'll look at the cells under the microscope, and they'll say abnormal or normal. But the more recent way, and that talks about DNA, is actually using modern technology to say, oh, this is something that's wrong, and we can pick it up actually faster. And it goes into how we screen people and how we don't screen them.
How long has that technology been around for? I'm not sure if I've heard that.
Yeah,
DNA
it's on the screen,
right?
yeah, within the last 10 years. And so again, you have the one that is looking at the cells and the ones that's looking at the DNA.
And then, Dr. Liz, there's also a vaccine available for HPV. Who should get it, and when should women be screened for cervical cancer?
You know, I think one of the things about vaccine is that there's been a lot of resistance and controversy about vaccines specifically because of COVID, right? One thing I will tell people is that with HPV, there was controversy and resistance up front, but what we have seen is over the last 10 years, since the vaccine became available, there's been a drastic drop in cervical cancer rates. Both men and women can get HPV, and you should really start thinking about vaccinating your kids by the age of 11 and 12, latest by 13, but again, there's some wiggle room. You want to do it before they contract HPV. In terms of screening of women, there's sort of two categories. There's 21 to 29, which is every 3 years, the sort of the normal pap smear. But once you get to 30 and above, you can actually space it to every 5 years and use that newfangled technology, the DNA, to really get that probe right.
Wow, okay. And lastly, let's talk about the resources available here locally in the borderland.
Yeah, absolutely. So again, Planned Parenthood probably gets a bad rap sometimes, and we're not going to get into that. But one of the things they do amazingly well is help women get pap smears and cervical screening. Project Vita, one of the FQHCs in the borderland, again, they do a great job. Most federally qualified health centers here in El Paso do a great job. And again, De Casa en Casa and Tiempo de Vacunare, led by Dr. Maloku at Texas Tech, again, do a great job. Cervical cancer prevention. You can get screening that's free or low cost depending on your income. And I say this all the time. We live in the borderland, but it doesn't mean that we don't have the resources to take care of our population. Avail yourself of these opportunities.
ABC7 medical contributor Dr. Ogechika Alozie, thank you so much for your time.
Thank you, sir.